Hello guys, welcome to my new video. So in front of you today I want to discuss the very important topic. This topic's name is what is a birth asphyxia, or in other words it's known as a neonatal asphyxia. What is a neonatal asphyxia? So in this video we already know that when the baby delivered via emergency LSCS or via NVD or via SVD, then oxygen play a very important role, and it is must compulsory. Baby needs to sudden cry, but in cases when the baby don't cry, it means that the baby don't get enough oxygen from the environment. We already know that in air oxygen is present. When the baby don't gain oxygen by environment, then the brain's cells death happen. So this condition is known as a birth asphyxia, neonatal asphyxia. So what is the symptoms? The symptoms of a birth asphyxia is the color of the baby is blue. In a clinical terminology, it says that the baby goes into the cyanosis mode. So it means that the baby have a lack of oxygen and severe deficiency of oxygen. In a future, after a later, this baby goes into the CP mode, means cerebral palsy. And in other words, if the birth asphyxia happened more than 10 to 12 minutes, then the baby shift to the ventilator. So what is a ventilator? A ventilator is a mechanical machine which provide the oxygen as the lungs provide the oxygen. But this is a later on story. The conclusion is that the baby, when the baby should deliver, they gain a oxygen sudden. In rare cases, if the baby don't gain enough oxygen, it means that your baby have a birth asphyxia or neonatal asphyxia. So in these cases, the baby goes into the NICU or neonates intensive care unit. The treatment should be injectable or via oxygen route by artificial level. So in this video, I describe about what is the neonatal asphyxia, how can we prevent. The preventive measure is that we should admit a baby in NICU department, and the other important measure is that we delivered or delivery happen or LSCs happen where the oxygen facility is available. Otherwise, your baby face a severe lack of oxygen deficiency problem. So it is a very vital. In this way, the baby maintain a vital. What is a vital? A vital is a parameter in which we conclude that a heart rate, respiration, and reflexes. So the saturation should be a 94% more than increase. But in a cases of neonatal asphyxia, the saturation decreased. It should goes on to the 65-85. So we should all take the adopt measures. These measures are very important, and the baby could save goes into the danger zone. So in this video, I give a detail about what is a birth asphyxia, what preventive measure we take for the preventing of birth asphyxia, how can birth asphyxia happen. So this is a very serious, and I want to discuss about that. So please visit those setups where oxygen facilities available. So I hope you like my video. Thank you so much for always your cooperation. Thank you so much for always your support. Be happy, stay blessed, take care.